We know it is very difficult to get certified as a case manager because of this catch-22 thing. You have to have case management experience. In order to get case management experience, you have to get a job, but a lot of those jobs require you to have case management experience. You're not really sure how to qualify to sit for the exam because nowhere can you get the case management experience that everybody requires. Here's a little bit about what I did because of that catch-22. As a disclaimer, the steps that I'm referencing today are steps that I took within the public health sector. So let's get into it. You have to meet one of 3 criteria to qualify to sit for the exam. Working for at least 12 months as a case manager while being supervised by someone who is board certified as a case manager, or working for 2 years without being supervised, or working as a supervisor for at least 1 year. The first step that I want to talk about today is getting this book, okay? This is called the CCM Certification Made Easy. It is your guide to passing the Certified Case Manager exam. It's written by a nurse, Deanna Cooper Gillingham, who is also a case manager. This is twofold in that, yes, it is your guide to passing the exam, but before we even qualify to sit for the exam, it's also my guide or our guide to learning more about case management, getting an idea of where you may want to practice or what specialty it is you want to pursue. Deanna gives a pretty good overview of like U.S. healthcare in general, insurance, reimbursement, how important it is for a patient to have a case manager in a lot of scenarios in order to help guide them and be their advocate through the healthcare processes. She really gives us an idea of where we fall as a liaison or communicator between patients and their end goals, not just in navigating the healthcare system, but also in meeting their desired goals towards better health or towards recovery. All right, so one area that this book briefly touches on very little bit is disease case management. You won't hear the term public health case management used because it's unofficial. There's not really a public health case manager. What it really is called is disease case management. Working as a public health nurse, your local community provides care to patients in the area or in the surrounding areas that require education and care in disease prevention or treatment for certain diseases or conditions, sexually transmitted infections, tuberculosis, HIV. These are areas where a public health nurse who may operate in a case manager type of role really is working closely with patients in the community to get them the resources that they need, the education that they need, maybe sometimes even working with translators to make sure that we're speaking the same language and the information is being received well and appropriately. So while I was working as a public health nurse, providing a case management style of care, I worked for at least 24 months providing case management services to patients without being supervised by someone who was certified. I then worked as a program coordinator and supervised folks who were providing case management services for at least a year. Think about maybe exploring the field of public health or community health as a way to still really build momentum in your career and in your journey towards your desired area of practice. Leave me a comment if this was helpful for you at all. I'd greatly appreciate it. And I will see you guys on the next episode. Okay, bye.